Hey everybody, this is Paul. It is August the 20th, 2023, and I'm making an update to my ACDF video. If you happen to watch that, you know in the last 20 seconds of that video or so, I said I'd make an update about 4 days later after that surgery, and that was on November the 18th, I think, of 2018. So we're almost 5 years later to get to the update. So just to update on that one real quick, I never had any issues again, and you'll see what's going on here in a minute. But the surgery site, you can see the scar. It's right in the fold of my neck, but no one has ever even noticed it. So what looked so ghastly to begin with all that time ago is really just a small 1.5-inch scar on my neck. I didn't have any other general pain except for the headaches. They did come back. I was dealing with migraines once again, but there probably was another reason that was occurring, and that leads to this. So for the last 5 years, I'd been running off and on again. Not a whole lot of problem. I had slowed way down back last fall, just due to some other things that were going on and some health concerns I had. I ended up with hyperthyroidism, and that's being treated just fine now. That's not an issue anymore. But what has led up to this thing, in February, I had twisted in my car, turning around to the back seat, just to get something, put something in the back seat of the car. I didn't twist hard. I twisted minimally to my right from the driver's seat to put a jacket in the back seat of the car. And when I turned around, something just didn't feel right. I started getting pain in my neck, and it continued to get worse and worse and worse as the week went on. I went and saw a neurosurgeon once again. It's a different one. Legacy Spine Center in Central Arkansas. This was Dr. Scott Schlesinger. He does fusions. Anyway, we wanted to work on some conservative treatment, so I started doing the epidural spinal injections again because I got an MRI and C6-7 was herniated. So just below, the exact level below my fusion had herniated, and it was a large herniation, and it ended up leading to excruciating pain in my left arm, but my index finger and thumb were completely numb, and I had pain in part of my middle finger with that. So pain down the inside of the arm and the tricep area up to my shoulder on the left side, and before everything had been right-sided for my other surgery. Everything on this one was left-sided. So I did 2 spinal injections. The first one lasted a month, and then I went back in early April to get a second one done, and that one lasted 2 days. 2 whole days of relief before the pain came back. So from there, we talked about other options, surgery, things like that. Well, it just so happened that he has another neurosurgeon he's partners with, Dominic Maggio, that does artificial disc replacements. So I had an appointment with him in early May, and based off of the MRI and based off of the fact that the spinal epidural injections weren't working that well, he went ahead and set me up for a nerve root block to confirm what level we were working with, that it was indeed the root at C6-7. So how that works, if you've never had a selective nerve root block for the cervical, they actually had me lay down, and with the spinal epidural injections, they go through the back. So you're laying on your stomach, and they go directly to the root the back way. When they're doing the nerve block, they're actually going right here through the front. He stuck a really long needle in right here beside this patch and threaded that needle all the way back to the actual nerve root. And then, of course, he shot it with a a liquid, some sort of medicine that caused instant pain, but right behind it was a steroid that numbed it instantly as well. Not the numbness where you have no feeling or anything like that, but all the pain went completely away. And when I told him that, he said, okay, then we know for sure, yep, that's the nerve root. And then it came down to really just having conversations with him on whether you want to have surgery or want to try to go the conservative route with the injections. So we talked about the injections, and yes, before I had my first surgery, the injections lasted for years. But the fact that I'd already tried 2 injections, and the second one only lasted 2 days, and then that nerve root block only lasted 2 days also before it completely wore off, I knew I wanted to go ahead and have surgery. So I wanted an artificial disc. I wanted that last time, if y'all remember right, but I couldn't get an artificial disc because of a piece that had broken off and was floating around back there, caused issues, so he couldn't do it. But this time Dr. Maggio could, and he uses the disc that I really, really was wanting to get anyway, and only 2 surgeons in Arkansas actually do this one right now. It's the M6-C, so the M6 cervical disc. It was developed in America, but it was solely used in Europe until I think last year maybe, or 2 years ago. It finally got approved for use here in the U.S. He does those, and it keeps motion in all planes pretty much. You can look it up, M6-C. They have them for the lumbar too, I believe, for that one. But anyway, so I told him I'd rather just do surgery and get this over with because I already know what, the route this is all going to take. So he said, yep, we can go ahead and do the surgery. That's a good course of action for you since you're, pretty active, especially still military. So we set the surgery up for August the 15th, and that leads to today. So what I had this time, instead of an ACDF, which is the anterior cervical discectomy infusion, I had, it's called arthroplasty, basically artificial anterior cervical disc replacement. So underneath this patch, I'm not going to take this off because I'm still getting through the healing process. There is a 1 to 1.5 inch scar. It's not on the same plane as the other scar. It's one level down, so it's right at my clavicle. He went in there and did the artificial disc replacement. So how did this process go? If you remember before, the last one was done at a hospital setting, required a 1-night stay. This one was at an outpatient basis with Legacy Spine Surgical Center. So totally different way of operating how this went. So on surgery day, I had to be there at 9 o'clock for an 11 o'clock cut time. And about 9:15, they called me to the back. My wife went with me. They had me change into the gown just like you would at a hospital. The anesthesiologist came in. And they all asked me where we operating. That way, they always know I'm on the same page with them. Anyway, and he asked if I had any questions. Went through my whole medical profile to make sure there was nothing that was going to cause an issue. And he said we're good to go. And about 10 o'clock, they gave me 3 medications right there in the prep area while my family was still there, just to relax me, I think is what that was for. And then they wheeled me into the OR at about 10:35. Now, something that was also different on this was outpatient. And with this one, I had, when they took me into the OR, instead of putting a bag over my face and having me breathe in the gas, this anesthesiologist said, I'm going to give you a cocktail here of a couple of drugs, and then we'll get started. Sure enough, he put that syringe in in my IV, and next thing I knew, I was waking up in the recovery area. So I'll fast forward to recovery. So the surgery was about 1.5 hours, my wife said. He was shocked at the size of the piece he got out. So that herniation had actually broken off since the MRI, and he pulled out a massive piece apparently, and it was hard to get everything done, but he was able to put in an artificial disc with no problem. I was in recovery for, I guess, about 2 hours in there. My wife said, I was moaning and groaning and needed pain medication and all this and that, which I don't remember any of. The first thing I actually remember is sitting up and then getting my clothes on so they could wheel me out to leave. So literally by 3 o'clock that afternoon, I was headed home. So 6 hours from start to finish for the whole thing, and I was going home. Just like the last surgery, the worst part of the whole surgery was the sore throat. I asked them to be really careful with the intubation tube, whatever. I assume they did, but they just can't. It's just hard for them to keep things from getting sore. And my throat was sore. The first 48 hours was terrible. I still kind of have a little bit of a rasp in my voice because my throat's still healing a little bit. But as best as I could tell, after I got home, I didn't have near the pain in my shoulders or arm or anything. It was the sore throat that was the problem. So I had 4 prescriptions when I came home. I had a 10 milligram hydrocodone. I had an antibiotic they put me on. They had me take Pepsid and a Medrol steroid pack at the same time, and then Flexeril for muscle relaxer. Like my first surgery, my goal for the narcotic was to be off of that as fast as possible. I did good with that, so being home by 3 o'clock on surgery day, which was Tuesday, I took my last narcotic Thursday at 4:40 in the morning. So right at 39, 40 hours is when I stopped taking the narcotics. So only a day and a half, little over that, and I only took 4 total pills, I think, in that time frame. And then I've stuck with just my other prescriptions. I'm going to take those all the way out just to be a good patient, and then see him again in 6 weeks for a follow-up. Same healing process is going to go on with this. The major difference too between this one and my last surgery had Dermabond across the top, and that stayed there, and I didn't have to wear any of this type of patch. This one, he had a Tegaderm over the top, which is just a patch, and then he had one of these sterile gauzes. He did not use any kind of a Dermabond. He did external sutures on this, and after he did that, he considered it done. I had a drain tube on the top instead of the bottom. The drain tube came out 48 hours after the surgery. I went up there and they pulled that out because it wasn't draining anymore. But what I have to do with this, I do have to be more careful with this one than the last one because there is no waterproof seal that's over the top of it. So I wear this type of a patch all day. And then at night before taking a shower, I bought Tegaderm. I put a Tegaderm patch over it that's waterproof and seal it all the way around. I take my shower. You don't let water hit it hard. And then I immediately pull that off after the shower, dab it dry just to make sure there's no trapped moisture there. And then I put another, this is a 2.5 by 2.5 patch with the paper surgical tape. And I'll do that for 2 more days or until there's no drainage, which so far there's been just a little bit of drainage from the hole for the drain tube, but that seems to be clearing up. And I think by Monday or Tuesday, I won't need any of that anymore. He did have me in a soft collar from the get-go. I'm not wearing it right now because I'm at home and I'm not turning my head. With this, like this right now too, I'm trying to be mindful to turn my body with my head just so that can kind of heal a little bit. Since there's no plate or anything back there, it's just that artificial disc sitting in there. But not expecting any movement of that or anything. But anyway, this will go away in about 3 days, and then when I take a shower, I'll have to be quick because any water that runs over it, you don't want it to just sit there. So quick shower and then out, and then it's just a matter of waiting for it to heal up, really. But I have plenty of restrictions. I can't lift over 5 pounds. Not supposed to drive for at least 2 weeks. I'll be back to work in 3 weeks time, and then hopefully within 6 months, they'll lift all of the bans for what I can and can't do. So that's really about it with this one. I'm happy to have the artificial disc. I'm happy with the surgeon I had. So if you're in Central Arkansas and want an artificial disc, I would suggest the M6C. Look at all of them. The Mobi C was the other disc I was looking at, and that's what I was supposed to get back in 2018. It has motion in most of the planes, but the M6 has got a special nucleus in the middle, and the brackets on top and bottom allow it to rotate every single direction in the plane. So it's literally like replacing the disc with a disc, literally. Had a great experience though, good attitude going in, just like the last one, because I knew, hey, we need to fix this because I got things to do, yada yada yada. He understood that. Surgery was uncomplicated. My mindset was positive going in, and it was positive coming out. It's positive right now. I'm already past all the pain. It's Sunday, and we're 5 days post-op. Honestly, I feel like I could do anything now, but I know I don't need to. So if you guys have any questions, leave a comment below. We had hundreds of comments on the last video. This one may bring up more. If you have any questions about artificial discs or about the last surgery or this surgery, just ask. I'll get to them as I can. I get email notifications when you guys post questions anyway. So with that, I'm going to call it a day. I promise I'll try to update this later, maybe in another 15 to 20 days after it's been about a month or so, just to give an update on everything. But other than that, y'all have a great Sunday afternoon. Thanks.